Hello friends, today I am here to give you an insider perspective of what branch of ophthalmology is going to be. Someone who is in a dilemma to choose between ophthalmology or some other branch, then this video is exactly for you and you are at the right place. Please watch this video till the end because I am going to share my views and my perspective about this branch during my residency days, in post-residency days and life thereafter. This video is less about pros and cons of ophthalmology and it's more about how your life is going to be if you decide to pursue ophthalmology for the rest of your life, and how your residency is going to be and how your life after residency is going to be. So guys, I did my residency in ophthalmology from 2017 to 2020 from KGMC, and then I did 1 year of senior residency from the same place, and after that I've done 1 year of job at a different hospital. So I'll be able to give you a very nice perspective of the journey of ophthalmology and how your life is going to be in this branch. So let's get started. So first things first, guys, ophthalmology is a beautiful branch. It might have heard people saying that ophthalmology is good for girls. Nothing as such. Ophthalmology is a beautiful branch for girls, for boys, for everyone. I'll tell you why. First of all, the most important thing which I also had in my heart, and I wanted to share it with you. You have to like doing things with your hands. You have to like doing procedures. You have to be skill oriented. So I like doing procedures, little small procedures that can bring change in the patient's life. So if you are someone who do not like too much of procedures or too much of surgeries or skill-based things, then ophthalmology is probably not a branch for you. But if you like these things, ophthalmology is definitely is a branch for you and you'll love it. So what I like about ophthalmology, and I think if you go into ophthalmology you'll love about it, is the branch is very precise. Mass of the branch will attract you definitely. So the first point is it's a skill-based branch where you have to love doing procedures, and your little procedure is going to make difference in patient's life. So second of all, which was a very important point for me to join ophthalmology, it was like I did not want it to be jack of all and master of none. I wanted to be master of one. I wanted to zero down my focus to one thing. So ophthalmology was giving me that. You have a very precise branch, very precise things to do. Of course, it has relations to systemic illness and you will have to know that, but your focus will be on eyes, and point is going to attract few of you because many of us want to be very super specialized, very subject oriented, focus oriented. So this branch will give you that. Third point is that the branch will give you opportunity to pursue subspecialties, go into super specialties in India, outside India. And the branch is also flexible enough to give you a freedom that if you do not want to go into super specialty and want to practice or want to go into academics just after your residency, you can go into that too. It is not that competitive that you have to do subspecialty and then only you will be recognized. And of course, doing subspecialty would be a cherry on the cake if you want to do subspecialty in retina, oculoplastics, pediatric surgery, glaucoma. That will just add a feather to your fur. So yes, you have a chance of fellowships, you have a chance of doing subspecialty, of pursuing a subspecialty, and you also have a chance of not doing these things and still doing good. Fourth thing which I personally like very much about my subject and about my patients is that no one is dying in ophthalmology. Of course, sometimes you have very critical cases. Of course, during COVID times we had mucormycosis which led to mortality, but in general you have a good patient, happy patient, and you make their life better. It's not that someone is dying and you have to see all that thing. It's just that they are in some kind of trouble which is still not that level of trouble, and then you are gonna make their life better. Fifth point is that what I personally like about ophthalmology is that you can actually see what is wrong with the patient. You can see the angle, you can see the blood vessels, you can see the hemorrhages, you can see the edema, everything. You'll feel so satisfied looking at everything, seeing it for yourself and then treating your patients. So it is something, it is not like you're not able to see. Of course, it is a learning curve. You will take time to learn how to see all these things, but you eventually will learn, and eventually you'll find it very satisfying that you are actually able to see what is wrong with the patient. Coming to the next point, so you are going to have a very good work-life balance with you. Of course, you have few ocular emergencies, but there are fewer emergencies. And another thing is that the life of a patient is not at stake. It's usually the patient is in some kind of trouble, but its life is not at stake. So if you have a call, you can just have some time. You have some time to reach the patient. It is not like you have to leave everything what you are doing and rush to the patient. Of course, you have to go, but you have a time. And if you are little late because of any reason, it is not going to take patient's life. So also because of your emergencies, you will have a life outside your career, outside your hospital. You can enjoy your life with your friends and families. So that is a very big plus point. Many people have this notion that it is good for girls because then they'll have time for friends and families. But of course, nowadays everyone wants a good life, good lifestyle, time for themselves. So it is a very good branch for boys as well. You have a good time to work, and then you have a good time to enjoy. Another thing in ophthalmology which people might think as a con, or people might think it's a negative point, but according to me, that is also a plus point in your career, that ophthalmology has a very long learning curve. Yes, it has a very long learning curve, I agree to it. All surgical branches have a long learning curve. Secondly, even if ophthalmology has a long learning curve, it has a very less quackery in it, because what you are doing under the microscope, only you know. Nobody else knows what you do under the microscope. So this is a negative point, that you will also take time to learn what you have to do, because many a times it will not be easy to follow what your senior is teaching, because he will be doing some surgeries under the microscope and will also be telling you how to do it. But this is also a plus point, because eventually you will learn, but there will be very less quackery, because no one else is gonna learn it in that way. No one else is gonna know how to operate under a microscope. Like while doing surgeries, we look into a microscope, and our hands are at the patient's table. So you have to have a very good finger-eye coordination, and sometimes also our legs are moving, because you have to change the focus, or you have to use cautery or something, or some retinal surgery. And so of course you have to have a very good coordination, and that you will learn eventually, because you will be doing small surgeries, extraocular surgeries, and then eventually you will be coming to an intraocular surgery. But no one else would be able to learn it so well. So this also will reduce quackery in your branch. Finally guys, you'll have a very good rapport and very good friendship with all other branches like medicine, pediatrics and gynecology, sometimes neurology. So because they'll be referring patients to you for many times for fundus examination or KF ring examinations. And also the plus point is that you would not be dependent upon any other branch, because you can do your own B scan, so you're not dependent upon radiologist. You can do your surgeries under block, so you are not dependent upon an anesthetist. Of course, some places and some cases you'll need a radiologist and anesthetist, but in regular practice you'll need them a little less, and you'll be more dependent upon yourself. So guys, these are my perspective and an insider's view to ophthalmology branch. Let me know in comment section if you want to know about any other branch or any other subject or any other query related to the counseling. This is me, Dr. Shaurya, signing off, and wishing you all the best for your counseling and best wishes for your future career endeavors. Thank you.